What is fentanyl and why is it killing so many people? This is a really important topic we're going to address today. Hey everybody, it's Dwight. Welcome back to a podcast to answer your questions on addiction, recovery, and mental health, put together by Wiseman Method opioid treatment specialists and rapid detox centers. I'm joined as always by Claire Wiseman, the founder and director of Wiseman Method, and also David Livingston, our clinical director and therapist. Along with some of the other tragedies that we're seeing related to the pandemic and people being out of contact with each other, there's been a huge swelling in the numbers of overdose-related deaths, and we're going to talk about one of the biggest parts of that today, which is the use of fentanyl. So that's a great question for us to start with then, is what is going on with fentanyl and what are the results we're seeing out in the community?
I believe that what we are seeing with fentanyl right now is absolutely insane, is absolutely preventable. And it's people are not aware of what's going on. That is fully absurd. There should be right now a media focus on preventing fentanyl overdose, and I don't understand why the silence. Most patients we treat, regardless of what they believe they're taking, they test positive for opiates. And most patients we speak with, they talk about losing a family member, a friend, a loved one, like, they talk about a routine, and it just should not be this way. Mm-hmm. So there is an influx of fentanyl in every corner of our society that is taking lives at rates unseen. And my biggest concern is the lack of exposure to this crisis.
Yeah, you don't hear people talking about it.
No, you don't hear the media talking about it. You don't hear on social media. Sometimes we because we look for news regarding opioids, overdose, treatment. So we are aware of what's going on because we speak to people all the time. We are aware of what's going on. But I think we learned with the beginning of the opioid crisis, when people start overdosing due to crazy prescriptions of painkillers, that being silent is not the right way to go. When people were dying and prescriptions were being written, left and right, nothing was said until the emergency rooms were packed, where people were dying to such rates that morgues didn't have space for them anymore. And I think we are seeing the same path, but at much higher rates.
I've heard people call it the Newsweek factor. Like with every drug that comes out, it starts as a miracle drug and then eventually becomes a Newsweek article that, that's a problem. It seems like that's
but I think
evolution.
That's different. I mean, this is not, although real fentanyl is used for medical reasons. The fentanyl I'm talking about is being manufactured in Chinese and Mexican labs.
So this
it has
is just
replaced
straight up illicit.
Every drug sold in the street, correct. So it's not the fentanyl you buy from a pharmacy.
Interesting.
This is because for them to smuggle heroin or pills to the country, I mean, it's a bulky thing to do, because fentanyl is so powerful in such tiny amounts. Is much easier and much cheaper to manufacture and much easier to bring into the country. With the border crisis right now, it's just flooding in. And the results are people are dying.
Do you find that it's a cross-addiction kind of thing, that people that are not able to get a hold of opiates go to this? Or what are some of the reasons people cross over to use fentanyl?
I think that's what's available, period. And that's what I'm trying to say to you. Regardless of what they think they're using, they're testing positive for fentanyl, and that's another reason they're dying. And
So
that's
people
why,
don't know.
for me,
Yeah.
Exactly. So we have patients, they're telling us now when they buy drugs, they have a tester to know if there is fentanyl and how much fentanyl there is, because 99% it is fentanyl regardless of what they're buying.
Right.
So
Scary.
I think is a healthcare crisis that's my major issue here is, again, why are we not telling the people to be aware, to be careful of what they're buying?
Yeah.
Why are we allowing so many people to die and just putting it to the side?
Right. That the fentanyl is easily manufactured. It's phenomenally potent and addictive. It's combined with who knows what else. You don't even know what you're getting. You know, you get some fentanyl, but who knows what else is in it. And it's flooding over. It's just flooding into the U.S. And because it's so addictive and it's so powerful, it's people are getting are getting addicted, and it's cheap to make. So that's the reason why it's in everything now. So as the amount of opioids that were on the that people had availability to one way or another through pharmacies and things like that, as that is all sort of slowed way down, and it's been replaced with the fentanyl, as Claire's saying, which is phenomenally dangerous because it's so unbelievably powerful, and you have no idea how much of it you're getting. Especially young people. I mean, they are all relating to have lost friends, and it's heartbreaking, and then in their recovery, it makes their recovery so much harder and their life harder because, people count on their friends and the people that they have in their life being around with them. It's one of the things that, is sustaining for everybody. So when you're losing people, it is, you feel like you lose a piece of what sort of fortifies you in your life, because our relationships are paramount to our health, and so when people are so it's a crisis, and people then feel less resilient sometimes, and it can be even more complex, but it's a crisis, and the fentanyl isn't probably being talked about enough.
Let me float out this thought. Do you think there's a chance people aren't talking about it because of lack of caring about? So if someone buys it, they're buying street drugs anyway. So therefore people have the bias we've talked about on the show before is saying, like, if you're using drugs, you're taking a risk and not caring particularly. What are your thoughts about that?
I think we are in such a different space than we were 20 years ago. I think that could have applied 20 years ago. Nowadays, everybody knows somebody that have an addiction issue. So I think it has affected all of us. It has affected us as a society. We can't just, sit at a higher, platform and look down and say, oh, no, those are people, those are addicts. Those are people that it doesn't matter. I think nowadays we are all sitting on the same level.
Well, that's good, and that's optimistic. I'm glad to hear that if you're not seeing people have that attitude as much.
It's true.
Yeah.
Well, because I think the opioid crisis brought in, the pain patient, the patient that had, 8 back surgeries. So it became a problem where people understood that any of us could be affected at any time. It also became a problem for those that did not get the mental health care they needed. So depression, anxiety, PTSD, all the above. So I think right now you can't say that. I think, we have become a society that have learned to scream, break, lose it for so many reasons. I think this is a good reason to start screaming and make our voices heard. I just believe that, sadly enough, one of the reasons people don't speak out loud is life. It's losing its value a bit. I think when David say that, young people say they lost, 3, 4, 5, even 10 friends, within a couple months, I think there's something also in their heart that dies with, you suffer so much on the first one, on the second one, on the third one, it becomes almost mundane, it becomes almost part of your reality. And I think a part of people whose hearts die with it, that you become less sensitive to it.
It's like a lack
Does that make sense?
A lack of concern and sensitivity for just kind of the value of life. I mean, it almost sounds like like a widespread depression in a way.
Correct. Indifference more than depression. Indifference to, and I don't think is a chosen indifference. I think is almost a protection of your own well-being. There's so much that hurts somebody that there is a limit where you say no more. And I don't think it's a constant consequence. I think it just happens. You deal with so much pain daily that it just becomes part of life, and it shouldn't. Death should not, especially preventable death.
If there's alienation with your family and you're losing friends, it is, where's the meaning? Who's sustaining you? That's what sustains people, is their ability to have their family, their friends, and people around. And when you start to see that disintegrate, they tend to cope more, and where's the healthy dependency, right? I mean, if people think of opioids at least in part as a problem with dependency, healthy dependency, then the more of the healthy dependency that we lose, the more vulnerable we are.
Yeah, you've talked about that, about how that affects the connection level. I think people don't often think about the healthy things in life to be dependent upon and how that can be a life skill. And so, because when we are dangerously independent or cut off, actually, right, then we're more likely to make decisions that are destructive for ourselves.
Really, society is held together by healthy dependency, right? That's the fabric of how it all works.
Sadly
right?
enough, the last few years have turned around. People are holding on to very unhealthy dependencies.
Right, and fentanyl is a dangerous dependency.
People out there who are listening and hear about this, what should they do for prevention, for safety, family members?
Well, if there has been, and again, I'm not talking about, our treatment. I'm talking about any treatment. If there has been a moment in our lives where we should be looking for some kind of treatment from opioid addiction, I believe is now. The risks of buying street drugs have just multiplied by 100. And when I say multiply by 100, I mean that, because fentanyl is 50 to 100 times stronger than any other opiates they can find in the street.
And when it comes down to it, someone trying to increase their profit margin, particularly in that illicit industry, it's never going to be a question in favor of people's health, obviously.
Of course not. And I think this is another issue when they say, why fentanyl now? Please. I mean, when you're talking about dealers, you're not talking about somebody that cares about your well-being. No. You're talking about somebody that is opportunist. We just came through a time where Corona, locked us all home, where we felt alone, where we felt depressed, and most people with addiction, just escalate. So it was the perfect storm for them. Let's create something that is stronger, more addictive, cheaper, this is where we find ourselves.
I remember the first time a client I worked with explained to me, he described to me how heroin was divided, and it's basically in a big brick, and people they cut it with other things because pure heroin will kill you. He saw with everything that was being packaged, there'd be a little crumb here and there that just fell off of the main thing that would just get shoved into a package. And he said, I realized just looking at that, I'm like, every one of those is a death potentially. And that just gets throws into. So it's not even just here's this stuff that I know is bad for you. It's here's this stuff that, you could do it just as you always do it, and it could die because you don't know what it is or what amount it and what else is in it.
Correct. But this is what I'm trying to say to you. Now, if you figured that most, and when I say most, I'm saying over 90% of what's being sold out there is fentanyl.
Yeah, it's remarkable. I mean, a huge, huge risk then.
Correct. So it's not the same as we used to say, drugs are bad, drugs are risky.
Right.
This is a different ball game altogether. So, again, I will go back to the silence. When I look at social media, they celebrate every donut day, peach day, you know what I'm saying? Mental health. There's a million days, some really important, some, not as important. Why are they not using their power to reach people, to talk about the overdoses, to put the faces of the people that are dying, left and right, to tell people about what are the percentages of, possibility of death if they buy fentanyl in the streets. And again, what are the treatments available? Phone numbers for help. I mean, why are we not doing that?
It's remarkable when you say, one of the things that is the most proactively preventative of what we're talking about then is having that dialogue, having an open dialogue that you can ask for help or keeping an eye on those that you love and care about and not just pretending there's not a problem. Yeah. And I guess that one of the things too, as we're reaching out there, anybody who's out there who hears us, that social media is sort of a division of labor potentially for anyone out there who wants to, do a little Google and throw up or anything you find or just share that concern with people. Because if people, I think, understand what it is you're saying, I want to tell people about this. I want people to be aware.
If they're not doing their due diligence, these are companies making billions of dollars every day from us. If they're not, protecting our well-being, I think we should voice it so they will listen and start joining with us. You have links to social media that you can also, put your thoughts. And if you have any ideas, you can share with us, and we can join as a team, and make it happen out there. Fully open for it. I actually started this morning with a hashtag, Stop the Silence. So hopefully that will, more people will join in.
Very cool. Yeah. Hashtag Stop the Silence. People can go there, and it is @opiates is Wiseman's Twitter.
Right.
Well. And people should definitely, that's one good way to go out and start sharing and letting people know. And once again, if you're on social media yourself, you have a piece of that you can carry, even if the big names or the big whatevers aren't putting it out there. Enough of us do, and then it starts to become a thing.
Yeah, and a story, a story of something that you have experienced, somebody you knew, or, just share with people what you know so they know. And sometimes you don't know. Somebody sees something on Twitter and would be a good reason for them to think twice.
And that's going to be our show for today. Thank you so much for being here. Go over onto Twitter. Check out the hashtag Stop the Silence. Let's try to spread that. I know that right after recording, I hopped on there and hit it as well on my own Twitter. You can go to @opiates. In fact, tag @opiates, if you will. When you put that out there, I'd love to see that hashtag Get out there. The Wiseman Method podcast is brought to you by the Wiseman Method Treatment Clinic and Medical Assisted Rapid Detox Facility. The show is produced by Pop Collar Productions, which is a company that helps you to have your podcast and have it do the things that you would like it to do. Our music, as always, is the song Medical by Clean Mind Sounds. For Claire Wiseman and David Livingston, I've been Dwight Hurst, and thank you once again. Please keep sending us your questions. When you have questions, you can always find answers. And when you can find answers, there's always a little hope.